It has been more known that the stimming is when an individual with attention deficit hyperactivity disorder, ADHD, repeats movements or sounds in an attempt to stimulate themselves. However, it's even more common now in people with autism spectrum disorder, ASD, as it is with people with ADHD. The reasons for stimming may vary depending on the individual and his or her environment. When stimming becomes problematic, it may require medication, self-control techniques, and altering the person's environment to deal with it effectively. When stimming interferes with everyday functioning or results in self-harm or injury, it may be necessary to take medication, teach self-control techniques, and change the person's environment. Throughout this video, we'll provide you with an overview of different types of stimming, the factors that trigger stimming behavior, and what can be done about it. Welcome to Autism Answers. Our mission is to provide you with informative facts about autism. They're easy to digest, as well as help broaden perspective regarding autism. In this video, we will discuss what is stimming. With that out of the way, let's get started. Even though stimulation has been identified as a diagnostic criteria for autism spectrum disorder, it does not necessarily imply that someone with this disorder has this as a characteristic. In some cases, you may observe some of these behaviors even when there is a diagnosis of ASD in you or in your loved ones. That's because at some point, many of us engage in self-stimulatory behaviors from time to time. You can use twirling your hair while talking, tapping your foot while studying, or even rubbing your fingers together to keep yourself calm when you're nervous. It's important to note that if you suffer from either ADHD or ASD, these behaviors tend to be more severe, occur more frequently, and interfere with you or diminish your ability to function socially, at school, or in a job as a result. An example of stimming can be found in the following. An example of visual display would be flipping pages without looking at pictures, watching water, excessive drawing, pacing, and spinning objects like coins or toes whilst doing this. In its auditory or verbal manifestation, it includes inappropriate or excessive giggling and humming, as well as constant singing. It also involves a repetition of odd sounds and noises, and a compulsive clearing of the throat or making throat sounds. Tactile or touch experiences, such as rubbing fingers, chewing at the insides of cheeks, excessive skin scratching, hair pulling, teeth grinding, biting or chewing fingernails are all physical symptoms. Spinning, rocking, swinging, or other movement-based activities based on the vestibular or balance systems. Playing video games or pretending excessively, acting out movie scenes repeatedly, sharpening pencils excessively, writing numbers or the day of the week repeatedly over and over are examples of other behaviors. It's difficult to determine why people with ADHD or ASD stim, but there are several possible explanations. The difference in brain development and activity in people with ADHD or ASD may affect their attention, their ability to sit still, and their ability to maintain self-control. For example, stimming may be a result of three differences in brain structure. Stimming may occur as a result of either an over or under-stimulating external environment. This is because depending on your environment and who you are, stimming may be used as a way to calm yourself, or it may be used to increase stimulation and focus. According to some studies, over time, stimming behaviors may be perceived as a pleasurable process in and of themselves, and repeated solely for the sake of repeating them. Stimming refers to a behavior that may also be observed in people with ADHD, although it is more commonly associated with autistic people. The reason for this is that they stim when there is no obvious or apparent trigger for the stimming to occur. As far as stimming goes, it may be more of a habitual action than an intentional one at this point. There are some stimming behaviors which do not require management, but not all of them. As far as how stimming affects your life, that will be a question for you and your medical team to discuss together before we make any decisions about treatment. In situations where the behavior has become particularly time-consuming or results in self-injury, such as bleeding from skin picking, it may be necessary to talk to a professional about what to do. It is wise for parents to avoid using punishment as a method of trying to control the behavior of their children when stimming is a problem. The experts discussing stimming behaviors that are associated with ASD have concluded that this punishment technique does not work when applied to these behaviors. In recent years, it's been reported that medication is the most effective way to manage ADHD symptoms in children of all ages. There are many medications available for the treatment of stimming. These medications help a person control their behaviors by reducing hyperactivity and impulsivity, as well as improving their ability to focus, work, and learn. The doctor may prescribe stimulant medications, non-stimulant medications, or a combination of these medications to help manage stimming behaviors associated with ASD or ADHD, depending on the severity of the condition. Behavioral therapy has been proven to be effective in helping individuals recover from unwanted, unhelpful, and undesirable behavior, and in teaching them how to change it. An individual can also learn essential skills, such as self-monitoring and self-regulatory skills, to prevent stimming through the use of behavioral therapy, with the help of a mental health professional who is trained in behavioral therapy. An integral part of cognitive behavioral therapy, CBT, is the development of self-awareness on the part of the individual. The goal of this technique is to accept what you think and feel about yourself in order to improve your focus and concentration. There are also family-based therapies and support groups that can be considered to help parents or spouses of children who are stimming so that they can better understand why their loved ones do what they do. There's no doubt that a professional can work with the family as a unit to ensure that existing strategies are not doing more harm than good, and that there is a plan in place that everyone understands and accepts as an effective remedy. As a part of a larger treatment plan that is aimed at managing ADHD and ASD symptoms, additional types of therapy may also be helpful. We urge you to tell someone directly if you or someone close to you needs extra support in managing stimming triggers and behaviors and needs assistance with managing them. A special education program, IEP or 504 plan, may be of use to help modify a child's workload or environment to help him or her succeed academically. For example, if stimming behaviors at school are disrupting other students or reducing academic achievement, an IEP or 504 plan may be of benefit. What are IEP or 504 plans? In schools, IEPs and 504 plans are formal programs that are put in place to ensure that children with disabilities are accommodated and that they are not discriminated against. There may be occasions on which they can be utilized to provide an adjusted schedule for classes that will afford time for periodic counseling or therapy as needed. Stimming is a self-stimulatory behavior that has been shown to be associated with ADHD and ASD. There are times when people who are known to stim use stims as a form of self-soothing or to take themselves more focused and attentive. Stimming can be regarded as harmless in and of itself, however, it interacts negatively with an individual's ability to live their lives on a daily basis. It can be an issue. You can stim in a variety of ways, including visual or visual stimming, such as watching water. You can also do tactile or touch stimming, such as rubbing your fingers together or chewing the inside of your cheeks. As a result, stimming is a condition that can be managed with the help of medication, therapy, and if necessary, additional support or educational education. Having stimming doesn't always mean that you or your loved one has ADHD or ASD, that you need to do anything about it or make any changes in their lives. If you are concerned about stimming behaviors, however, you might want to consider reaching out to a mental health professional or your healthcare provider. This is if you have concerns about these behaviors. It is helpful to be upfront about how you or your loved one's stimming is affecting their lives. This is because they are stimming and how you are the most appropriate treatment for their specific needs in conjunction with your medical care team. And that wraps up our topic for today. What are your thoughts? Let us know in the comment section down below. If you want to watch content related to this topic, make sure to check out our channel. Don't forget to hit like and subscribe. We'll see you in the next video.